Welcome back. Now that hospitals and medical centers are open for business once again, patients have begun to return for elective and other non-emergency procedures. At Spectrum Health for orthopedics, that means joint replacement surgeries have returned, and some of these include your knees, hips, or shoulder replacement options, which are done for an outpatient option as well. But here to talk more about joint replacement surgery is Dr. Chris Sherry. Good morning, Dr. Sherry.
Hi, how you doing? Thanks for having me.
Absolutely, our pleasure. So what is joint replacement surgery and which joints can we replace?
So joint replacement surgery is a procedure that's performed when we have end-stage or bone-on-bone arthritis in the affected joints that's leaving patients with significant pain that affects their quality of life and activities of daily living. We replace the joint with prosthetic components, a lot of times metal and plastic pieces, to eliminate that arthritis and leave the patient with a pain-free joint. As far as what joints can be replaced, the majority of the joints in the body can be replaced. There's shoulder replacements, ankle replacements, elbow replacements. The most common joints that are replaced are knees and hips, which is what I do for work.
Who would you say is a great candidate for these?
So we look at patients that have end-stage or bone-on-bone arthritis in their affected joints. They have daily debilitating pain that affects their quality of life. They're not able to function and do the day-to-day activities that they normally like to do. These are patients that do very well with joint replacements, and we can return their quality of life with these procedures.
And I don't know if this is a weighted question, but how do you go about replacing a joint?
Sure, that's a complicated answer, but for instance, I have a knee replacement here. Let's just give you a little bit of a visual. But with the knee replacements, we look at basically reshaping the ends of the femur or thigh bone and reshaping the top of the shin bone, which is the tibia. We replace them with a combination of metal and plastic pieces, and this allows for a painless joint with good range of motion and returning that patient to normal day-to-day activities.
Are there other options rather than replacing the joint?
Absolutely. We always try to exhaust all conservative options before we talk about joint replacement surgery. We talk about things like anti-inflammatory medications like ibuprofen, Motrin, Aleve. We talk about the exercise aspects of rehabilitation, working on stretching, strengthening the muscles around the affected joint to help take pressure off the joints. We do injections into the knees to help reduce inflammation, help with pain, swelling, stiffness, and really leave the joint replacement as the very last option for patients.
And let's talk about recovery time.
Sure. The procedures on average take around an hour to do. We get patients up walking right away. Recovery time is a little bit different for everyone, but essentially, once we get you through the rehabilitation process, patients will have a painless joints, good range of motion, and getting back to those activities they want to do on a day in, day out basis.
And let's talk about the extra precautions that Spectrum Health is taking right now during the pandemic to ensure patients are safe.
Absolutely. Spectrum's doing a great job during the COVID pandemic here, taking lots of different precautionary measures to limit the spread of COVID. We're testing all patients that undergo elective surgery for COVID prior to coming into the hospital. We're requiring patients, family members, employees, physicians all to wear masks at all times during the hospital. As a surgeon, I'm washing my hands all the time anyways, but really emphasizing hand washing on a regular basis. All these are really designed to reduce the spread of the virus, and it's been very successful for us.
And finally, I know we've grabbed a lot of people's attention that maybe have been putting this off and they know they need to come see you. So what are other people saying that have had these joint replacement procedures done?
Patients do very well with these procedures, and the most common thing that we hear is that I really should have done this much sooner than I had it done. So patients, they do great. They restore their lives and get them back doing everything they want to do. And patients are very pleased with these procedures.
Wonderful. Well, we do thank you so much for your time this morning, Dr. Sherry. So total joint replacement surgery, once again, is the last line of treatment for everybody, but you want to go ahead and check it out. There are all the details on the screen, spectrumhealth.org/orthopedics. Give them a call, 616-267-8860.